All it takes is one night of not getting a wink of sleep to fully appreciate the benefits of good sleep hygiene. Did you know that restful sleep is crucial for maintaining alertness and health? Here's how it works. The brain's proper functioning depends largely on our sleep hygiene. Like healthy eating and physical activity, getting enough sleep is crucial for cognitive health. Yet, 1/3 of Canadians report sleeping less than the recommended amount of 7 to 9 hours per night. Sleep is a key part of the learning process, affecting attention span and memory at any age. When we are asleep, our neurons are busy consolidating memories and learn information, as well as organizing and storing the day's experiences. In other words, the brain continues to learn during sleep. The brain also cleans itself while we sleep, flushing our waste products like beta-amyloid and tau proteins that can damage neurons. Not getting enough sleep means the toxins are not effectively eliminated and can accumulate. Over time, this harmful buildup is associated with a greater risk of developing Alzheimer's disease. Catching those diseases could therefore play an important role in maintaining good cognitive health. Getting 7 to 9 hours of sleep a day, including naps, helps keep your brain healthy. Anything less than that can cause sleep deprivation. In the short term, lack of sleep affects brain function, mood, and quality of life, and can lead to reduced attention span and alertness, slower information processing speed, memory problems, mood swings, difficulties making decisions and solving problems, drowsiness. In contrast, a good night's sleep helps you stay alert, focus better, think more clearly, and have sharper reflexes. Sleep can be affected by all sorts of situations. A stressful period, certain medication, too much screen time before bed, and menopausal symptoms are just a few examples. Chronic sleep deprivation happens when lack of sleep becomes regular and its impact are making life difficult for you. Talk to your doctor or healthcare professional if you often feel tired, feel irritable, have trouble concentrating or getting up in the morning, experience extreme sleepiness like a frequent, uncontrollable urge to sleep. You may have a sleep disorder or other health problem. In any case, there are solutions to help you sleep better. When left untreated, sleep deprivation or a disorder like obstructive sleep apnea increases the long-term risk of developing neurocognitive disorders. Lack of sleep can also contribute to a range of health problems, many of which are risk factors for neurocognitive disorders and include high blood pressure, cholesterol, type 2 diabetes, abdominal obesity, symptoms of anxiety, and depressions. Sleep gives you the energy and focus to perform your daily activities, including taking care of yourself and your health. As we age, we often experience changes in our sleeping patterns. Aging is associated with physiological changes that make sleep more fragile. People over the age of 60 may experience lighter sleep that is interrupted by more frequent awakenings. They may also feel sleepy earlier than usual, meaning they go to bed earlier in the evening and wake up earlier in the morning. Or they may need fewer hours of sleep at night but more nap during the day. In any case, poor quality or insufficient sleep is a not normal part of aging. Good sleep hygiene is a must for preserving cognitive vitality and health. You can start by getting 7 to 9 hours of sleep every night, setting a regular sleep schedule, going to bed and waking up at the same time every day, including weekends, limiting caffeine and alcohol intake, as well as screen time before bed. Go ahead and get some rest. It's not laziness. It's key to staying mentally and physically active throughout the day.